So hello, my name is Lattermann. I'm the Chief of Sports Medicine at the Brigham and Women's Hospital in Boston, and I am demonstrating a version of an MPFL reconstruction, the one that I've been doing for the last close to 20 years now, which is a suture-based fixation on the patella and a bone tunnel fixation on the femur. So this is a little bit of a more complex case because we are doing both an MPFL reconstruction as well as a lateral arthrotomy in order to get to the patella for an osteochondral allograft. In this case, I will do the MPFL in a percutaneous fashion, and then we'll add the lateral arthrotomy to it. So what that requires, and this is not uncommon in cartilage repair procedures, is a lot of going halfway on one procedure and then halfway on the other before you finish. So we'll start with the MPFL preparations on the patella, then we'll do and we'll dock the graft into the patella, then we'll do our lateral arthrotomy, do all the work for our osteochondral allograft, and then at the very end we finish the MPFL by attaching it into the femur. So for the MPFL reconstruction, I use a percutaneous incision that goes basically from the noon position at the patella to the 3 o'clock position in this case, or in a left knee it would go to the 9 o'clock position. And the MPFL actually attaches at the 1 o'clock position and the 3 o'clock position. So here is basically where that MPFL would be sitting. And then you see here there's a little bone trough here now that I've created, and this serves as my attachment point for my tendon. And this would be now the time where I would take a 2-0 drill and make a drill hole across the patella right here and a drill hole across the patella right here. Look very carefully at your drill, because the patella is a sesamoid bone with cortices anterior and posteriorly. So you want to stay in between these cortices. And if you are, your drill will show you that there's a little bit of fat that will creep up on the drill, and that indicates to you that you are in the right direction. So you'll start putting that in there. And the second one would be at the 1 o'clock position up here. And again, you go horizontal across the patella, and then you raise your hand just a little bit so that they are a little bit convergent, but not completely convergent, so that you maintain a bone bridge on the lateral side of the patella. Okay, so this is my lateral incision, and then this is my portal, and so this is basically where we do our arthrotomy. The lateral edge of the patella, you see very nicely exposed the entire way right here. You see here, this is basically the entry into the joint right here through the fat pad. So that basically gives me access to my patella here, typically the lateral facet in the overriding area. And you see here, the defect is in this area right here, which is very typical. And then one simple trick that makes it fairly easy to work here is if you just put some sort of a pole suture that is preferably the largest suture that you have in your arsenal, and then you suture that along the lateral retinaculum here, and it essentially serves as your retractor, because that will allow you to invert the patella very nicely. Alrighty, good. So now we have our arthrotomy done, and then we have our graft ready. This is our typical MPFL graft. It will end up basically fitting into it like that, right? 2 fixations on the patella, 1 fixation on the femur. You typically need about 10 centimeters of graft when it's double, so 20 centimeters on the gracilis or semi-T. So we have our little pole suture here. We pull that quickly through. So now we have our 2 sutures here. Now we can pull our graft in. So this is number 1. Pass the second one through. Alrighty, and so now what you have is you have your attachment for your MPFL, and that attaches very nicely. Right, so this is basically what we do here, and then on the lateral side here you can essentially just tie this, and you see I'm not in the articular surface. Just tie your graft into that. What's important is to check over here that you have no suture outside of the actual patella, because suture does not heal to patella very well. Tendons do. So this is my patella fixation, and then once we are ready with the rest of the MPFL, we'll basically prepare that onto the femur here. So for the allograft now, remember I had put that holding suture in here so that I can invert the patella to work on my facet over here. We have sized this to be a 20, and ideally we want to just bury it right into the outside cortex. The first thing that I do is I like to test first that my size is really adequate. And so I'll bring this over and make sure that I really address the entirety of the defect when I'm doing this. So now we are reaming the defect. Now we have our defect marked very nicely. So you measure all 4 quadrants. And the west is a 5. And that's about what we want. Between 5 and 7 is ideally what you want in terms of your graft. All right, now we're shifting over to the allograft workstation to prepare the allograft. You have your graft over here that typically comes in a bag with culture media. And then you have your patella that is sized right here. I have my lateral facet over here, my medial facet over here, and I want to take a graft from my lateral facet. We double check that everything is nice and tight, and then you take your hollow drill. So normally that means at this point a lot of irrigation so that you don't kill the chondrocyte. Once you hit the articular cartilage, you go. Otherwise you can easily create multiple passes. And then once you are through, you push it through. And you also see that the thickness of the articular cartilage is much thicker over here than it is over there. And so I mark that for myself so that I know the really thick portion of my articular cartilage here I want to put into the 7-8 o'clock position. So that's where I mark it. But what I do need now is I need to basically kind of sort of align these perfectly so that I really know that when I'm cutting this, that I'm cutting it correctly. And then, you know, I use a large saw blade to do that by my holder. There you go. This is our graft, the way that we are going to be implanting it. And again, I marked my thickest articular cartilage. That's my 7 o'clock position in this case. And you see here, this is our mark for our 7 o'clock position, which will go over here. And then you use finger pressure to try to push it in as much as you can. Here on the medial facet we are perfect, and on the lateral facet we have a little bit of a step off there, right? If it is just that very edge, you can actually go and trim that edge down a little bit. You do use a 15 blade for that, and you just basically very carefully take that very edge out and trim that down. Now you have your graft in place here for your patella. So that is our osteochondral allograft. Now we come back to finish our MPFL here. So out here is our layer 1, right? And underneath it is our layer 2. And that is where we want to basically start pushing our MPFL through. Now under C-arm, typically you palpate the adductor tubercle and you try to put the pin into the adductor tubercle, and then under C-arm you confirm your position. Alrighty, good. And then you come right across the femur and you retrieve it somewhere over here on the lateral side. And so this is basically going to be the tunnel for your MPFL. And the 7mm acorn will typically be a 55 to 60mm tunnel. So if it's much shorter than that, then something is wrong, and if it's much longer than that, you're out on the other side. So this is our pole suture for our MPFL now. And so this is basically part of our fixation now. So normally this is a very thick, like a number 5 type suture or a tape that you use for that. And now what we'll do is we'll pass this suture through the layers that we had identified earlier, through layer 2, all the way down to the incision right here. And you can take it out, and there it comes out. And so now we just shuttle the MPFL, shuttle the suture through first, and now what you do is you basically guide that MPFL around the corner and into the femur. So now you have your MPFL reconstruction here. You can feel it very nicely, right? And you can, what I do now at this point is I let everything sit. I take the knee from a full extension all the way through flexion, Make sure that my graft is not too tight. So we hold this at 30 degrees. I stabilize my kneecap because when you put that screw in now, it has a tendency to over-tighten the MPFL. So I make sure that my lateral side here sits right over the lateral trochlea, and we are tightening the screw up. And just feel for the edges, make sure it is nice and sunk. All right, and so now you've done basically your osteochondral allograft on the patella and your MPFL, and you repair the capsule primarily.